My name is John Oudyk. I'm an occupational hygienist with the Occupational Health Clinics for Ontario workers, and I've been there for almost 34 years. I was studying chemical engineering, and during my work terms, I kept running into health and safety issues. And when I graduated, I took a health and safety job with a firm that had a number of foundries and factories, and although I never studied occupational hygiene, I always say that those foundries and factories were my textbook. That's where I learned about how to identify hazards, measure them, and think of how to control them and design ventilation and things like that. The clinics were started in 1989, and since then we started off with 2 clinics, and now we have 7 clinics throughout the province. OHCOW was set up to help workers deal with their occupational health concerns. And it's not just for workers, it's for any workplace in Ontario. We're funded provincially, not nationally. And so any workplace that has an occupational health concern can ask for help, and what that help can be is an occupational hygienist, ergonomist, nurse, doctor. We can meet with the Joint Health and Safety Committee and discuss their concerns and figure out a strategy on how to assess their concerns, whether that's through exposure measurements or through medical reviews, that type of thing, and then recommend how to fix the problem, how to reduce it or eliminate exposures. We also have a clinical service for individuals where any individual who thinks they have an occupational disease or is even worried about getting an occupational disease in the future because of the exposures they've had or currently have, they can self-refer to the clinic and be seen by an occupational health nurse and a doctor, and if necessary, an ergonomist or a hygienist can help in assessing the exposures. We also do some education work. If a union, for instance, wants a presentation on or a workshop on noise or asbestos or some hazard that their workers are concerned about, we can put one together and we can customize it to the situation they're in. We also get involved in a bit of research. We're often collaborating, being the bridge between the academics and the workplace. In 2008, OHCOW had its stakeholder meetings, and we asked health and safety reps and compensation reps what kind of tools they needed to service their members and their clients. And one of the things we came across was there were lots of tools for lots of hazards in the workplace, but there were no tools to deal with workplace stress. And so a subcommittee was struck, and we called it the Mental Injury Tool Group. And out of that, we sat down and we looked at a whole number of different stress surveys, and we talked to people who have been using stress surveys in workplaces, and we came up with the Copenhagen Psychosocial Questionnaire, or COPSUC questionnaire, and we piloted that at a number of union health and safety conferences, and we got feedback from people saying, you know, you're missing this, you're missing that. And so we built up some extra questions with the COPSUC questions, and that's what became StressAssess. We launched in 2018 a web app which allowed people to create their own StressAssess survey and distribute a survey link in their workplace and then get an automated report. And that was when we got an inquiry just after we launched it from Peter Schnell. And I had known of Peter Schnell. For years. We used one of his slides from one of his courses that he put the PowerPoint presentations online, and we downloaded them and looked at them. And he had one slide which distinguished the difference between taking a psychological approach to workplace stress versus a psychosocial approach. And that really captured what we were trying to do. And so it was really neat that he contacted us and was curious about StressAssess. And so we started a conversation, and I met Marnie. And then we also met in 2019 at a work stress conference that's put on by NIOSH and the American Psychological Association. And we worked together on a workshop that presented some of our work and their work. And so we got to know each other, and then the collaboration began. And I believe that for a while there, on the Healthy Work campaign website, you were offering the StressAssess survey until you could make your own. And now that you've got your own, obviously, you're using yours, but ours is still there if anybody wants it. I think it was 2018, I was at the United Steelworkers Conference, and I was giving a workshop on measuring stress in the workplace. And David LeGrande was sitting in the room. And I knew he was associated with the Healthy Work campaign. So during the session, I kind of alluded to him, but I didn't know his name. And I said, I'm sorry, I don't know your name, but I know you're associated with this, and maybe you can tell us a bit about that. And his response was, well, it's a good thing I know my name. Anyway, so we met each other, and then at the 2019 Stress Conference, the NIOSH Stress Conference, we also worked on the same workshops together. And so I got to know him and greatly admired his experience and his motivation for dealing with stress for workers and how important it is. The workshop that we're planning is to try to get health and safety reps and activists give them some tools on assessing stress in the workplace. And the idea of measuring stress in the workplace is that you take a measurement and then you identify those areas that need work, and then you work together and try to improve the psychosocial conditions in the workplace. Everybody knows there's stress in the workplace, but something can be done about it. And there's an old adage, if you can't measure it, you can't manage it. I don't believe that old adage, but a lot of employers do. So maybe that's a selling point for asking them to get involved in doing the survey at the workplace. And once you have a survey, the value of the survey is that it depersonalizes things. It's not John who's the problem or so-and-so. This is the feeling in the workplace. And it also provides a vocabulary. We found that when people did the survey, they came back and said it was really helpful to put labels on some of the issues. And it helped us to better understand them, and also to think of solutions that are more specific, rather than just getting rid of John because he's a pain in the neck. We learned early on that just doing the survey isn't enough. If you do a survey and you don't do anything about it, you're wasting your time, and you're probably making things actually a bit worse because you've asked people about their problems and then ignored them. So what a worker in a workplace can do about these issues is commit to, first of all, we have a 5-step process where we suggest that they first of all learn about what they're getting into. Then they need to organize themselves, get buy-in, because without participation of everybody in the workplace, it's going to be hard to make these significant changes. Then you can do the assessment, and once you've got the assessment, you'll You'll be focused on what needs to change, and once you've changed those things, you can reevaluate them. And you need people who are committed for the long term to be able to hang in there when the going gets tough, and the going will get tough, and persist in demanding and facilitating how to get a better workplace.